Yep, we have 15 people here.
Excellent. Well, this is perfect. Thanks so much, everybody. Good afternoon, everyone, and thank you so much for joining Child Safety Link for the first presentation of our speaker series. Today's presentations are on two very important reports, the One Chance to be a Child report and the Atlantic Cost of Injury report. See, a few people are trying to get in. Great.
I can admit them on my end, Sandra.
Oh, thank you.
Yeah.
Before we begin, or before we get too much further, I'm going to introduce myself. So my name is Sandra Newton, and I'm the manager of Child Safety Link. I want to welcome you, and I want to go through just a few housekeeping items before we start. As you may have seen when you joined the presentation, we will be recording these presentations, and they will be available on our website later in the month. Everyone's mic should already be muted, but I would like to ask you to keep them muted during our presentations. And your camera can also remain off if you wish. To ensure as smooth as possible session, I would like to ask that if you have any questions, to please put them in the chat box. If you're not familiar with the Teams platform, you will find the chat function at the top of your screen, and it should look very similar to the image that I pasted here. Child Safety Link's Mallory Cornelius will be monitoring the questions, and if you can ask, you can ask during the session, but we'll try and wait till the end of the presentation if that makes sense. Anna will be here to also answer any troubleshooting questions you might have. So if you're having any issues, you can put that in the chat as well. So again, today we bring two presentations, which will be approximately 15 minutes each with some time for questions. We would like to begin by acknowledging that we are in Mi'kma'ki, the traditional and unceded territory of the Mi'kmaq people. We are all treaty people who benefit greatly from the shared resources of this land covered by the treaties of peace and friendship. Before we begin, I would also like to provide you with a very brief summary of Child Safety Link. So Child Safety Link is an injury prevention program at IWK Health dedicated to reducing the incidence and severity of, unintentional injury to children and youth in the Maritimes and Atlantic when appropriate. Child Safety Link is committed to working with community organizations, governments, and other partners to ensure children are as safe as necessary at home, on the road, at play, and at school. Our at-home work focuses on home safety, which includes poisoning prevention and falls prevention. Our road safety work includes child passenger safety and pedestrian safety. The at play work looks at concussions and ATV safety. And at school, this is going to be a new one for us. So in the future, we're going to be addressing all of our topics in the school context. And we will hope to get a better sense of the work we'll be doing in schools over the next year. This November will mark Child Safety Link's 20th birthday. We launched Child Safety Link on November 20th, the International Day of the Child, to celebrate. And to celebrate, we decided to host a webinar series to highlight the importance of child injury prevention and promote the work of Child Safety Link. As mentioned, today we have two presentations and each will take approximately 15 minutes. Today, I will also be one of your presenters, so I will introduce myself. So again, my name is Sandra Newton. I am the manager of Child Safety Link, and I've been with Child Safety Link since the beginning in 2002. Over the past 20 years, I've had the opportunity to teach health promotion policy, as well as the injury prevention course at Dalhousie School of Health and Human Performance. I do have a health promotion background, completing a Master's of Science in Health Promotion, and you can see the rest of my bio here. I will be presenting on the Atlantic Cost of Injury report. And it gives me great pleasure to also introduce our other speaker who will be presenting on the One Chance to be a Child report. Laura Stymist is a pediatrician working in pediatric emergency medicine at IWK Health. After finishing a fellowship in social pediatric medicine with a master's in children's law and policy in 2021. Laura was appointed Director of Advocacy for Children and Youth with Dalhousie's Department of Pediatrics. Since 2018, Laura has co-led the development of the One Chance to be a Child report, released in 2022. So Laura, while I'm going to stop presenting and you could bring up your slides. There's always this awkward silence of getting the other presentation up, so give Laura a moment. And Laura, you're on mute, but you probably know that.
Oh, perfect.
There you go.
Are you seeing the slides at this point?
They are thinking about it at my end, but
Got it.
there we go.
Perfect. All right, well, maybe I'll go ahead and get started. Thank you so much, Sandra, for the invitation into Child Safety Link in general, for allowing me to come and chat a little bit about this report. I'll try to keep it relatively brief. I'm sure most folks here are excited to hear all about what Sandra has to say, but hopefully this brief chat will be a nice little frame to get us thinking about concepts around well-being, child rights, and social determinants of health as we think about some of the cost of injury report findings. So I'll be talking to you about the One Chance to be a Child report, which is a project that was a partnership between Dalhousie's Department of Pediatrics and Dalhousie's Healthy Populations Institute. And I hope no one was doing the math in the bio there. We did start this work in 2018 is the truth, and the report was just released in April 2022. That timeline will give you a sense of kind of the work involved, which does really represent a collaborative effort of a large and passionate group of people who I just want to start by thanking. They're not all here today, but there were many really critical authors and project team members who represent child service providers, researchers, and advocates who all helped to make this report possible. Our main objective through the project was really to just get organized on behalf of children and youth in Nova Scotia. Our goal was to bring together existing population level data in one place to really create the snapshot of how child and youth are faring in the province. Certainly as a collective, we believe data is super critical to making more informed decisions and to evaluation, and especially when that data is paired effectively with the stories and voices of young people. So knowing what data exists about children and youth allows us to move the mark on these issues, but it's also an opportunity to look at where there are gaps and to see how, as people interested in advancing the health and well-being of kids, we can help to fill those data gaps. As you may have seen on the first slide, we framed this as a data profile on child and youth well-being. And really, we titled the report to acknowledge this foundational period of childhood as it relates to thinking about a better future for our province. And the One Chance idea, we wanted to really highlight the urgency of getting things right for kids, because as we all know, childhood happens just once and is a super critically formative period. And fortunately, there are multiple opportunities over a child's development to get things kind of right, but we have to be very conscious of well-being. Many of the folks who were part of this project and conceiving of it were from a health background, and many of us have probably heard this definition of health by the WHO that lists health as a state of complete physical, mental, and social well-being, and not just the absence of disease. So we wanted to drill down a little bit more into that broad concept of well-being, and we really needed to start by understanding what does that mean. We really came to find that there's no official definition of well-being, but it's a term that probably means something a little bit different to different individuals or communities depending on their experiences, culture, and values. In general, what we found though is when adults and kids have been asked about what well-being means, they usually take it to mean the things they need to have a good life. And those who conduct research in this area have gone on to kind of conceptualize the concept of well-being further as being this combination of a person's objective living conditions as well as how they feel about or have experiences. And unlike in adults whose well-being it may be considered relatively static. When we talk about child well-being in the present, we usually also link that to a prediction or imagination of what their well-being will be in the future when we look to measure or think about this concept. So we wanted to use well-being as the frame by which we organize data about children and youth in Nova Scotia. And to figure out what are the components or things we would need to see to know that children are well, in addition to getting their input directly, we kind of used the United Nations Convention on the Rights of the Child as an idea of things that may be in place to create well-being. And for those who aren't familiar, the UNCRC outlines this broad set of guarantees that all children and youth have, regardless of who they are, including, for example, the right to be protected from harm, the right to health, to food, clothing, shelter, a safe home, among many other rights. And I think it's important that it's to emphasize that these are not just kind of nice to haves, they're kind of legal entitlements and moral entitlements of children. And Canada actually ratified this Convention on the Rights of the Child in 1989, and it commits us as a country and in turn as the nation's provinces and territories to respecting the rights of kids. So really it is both the federal government and the government of Nova Scotia's legal responsibility to implement laws and policies and services and programs that help to actualize and protect child rights. And we really believe that if you were to see the full embodiment of children's rights, well-being in turn would follow in many respects. So those were the two main frames that we used to gather and analyze data. And the report ultimately collected just swaths of existing data about children and youth in the province and drilled down onto about 80 data points, which met general criteria, inclusion criteria. And those criteria included things like whether the data would be reproduced in the future, whether it would be comparable to other provinces. And I think it's worth acknowledging that there are definitely limits to population data, and we were aware of those in our approach to choosing what will be included. But we kind of adhered to this concept of FUPS data in carrying out this data profile. And I like this concept, which basically was created through the Child Outcomes Research Consortium in the UK. And FUPS stands for flawed, uncertain, proximate, and sparse. And I think that describes a lot of the data that we found in Nova Scotia. And just to give you an example of the way that this FUPS data may play out, sometimes the information included was from small survey samples. Those surveyed may not have been selected at random. They may not always represent the diverse experiences of different groups. And sometimes survey or administrative databases were missing data. So I think it's worth acknowledging that while we did use inclusion criteria to pick the best available data and that the data have some limitations, we still think that there's meaning and that this data can be useful. I think, again, our goal was to find information that could better help to inform debates and decision-making and ultimately spark some conversations about how we can do better. Also worth mentioning that a critical action we took was to engage young people to understand what well-being meant to them in the province of Nova Scotia and what they wanted people to know about their well-being. So those data points I was just discussing were kind of organized into the broad domains that you see on your screen. And with permission, the titles from the domains were borrowed from UNICEF Canada's Index of Child and Youth Wellbeing. And as you can see, they cover topics from physical health to education, to the natural environment, to whether a child feels like they belong. In some areas, we really felt that the data available facilitated kind of a more comprehensive look at the issue. And so where that was the case, we did a spotlight essay, and in particular, those were in the areas of food security, oral health, and substance use. And then in consultation with a number of community leaders, we decided that exploring any differences in outcomes for specific diverse populations in the core sections or domains I just mentioned wouldn't necessarily be appropriate, because really those outcomes need to be supported with appropriate historic and cultural context. So any of those differences in outcomes were explored in specific population level essays that you can see on your screen there. I'm just going to offer that all of this information is available and hosted on our website, onechanceNS.ca, where you can find the report, a summary, more information about the recommendations, and can even add your support through an endorsement if you choose. But I'm just going to go over some key findings and touch on some of our recommendations. And I think what you'll see, certainly as you saw, there's 80 different data points included, so I'm just going to hit some high-level points. But I suspect what you'll also find is, in general, the majority share of children and youth in the province appear to be doing well in a number of areas, but I think the author and project team's assessment at the end of this report was just this idea that there's yet still an unacceptable number that are being left behind. So while most children are doing well, there's still so much that we can do to improve in terms of well-being and rights. For example, when we looked at children's incidence of experiencing bullying in the province, you'll see that among grades 7 to 12 students, kids are reporting being bullied somewhere between 1/4 to 1/3, or having been bullied in the last 30 days. And another, almost 1 in 5 feeling threatened in school. So again, while the majority share seem to be doing well, just an unacceptable number having this experience of harm and violence. Should also just point out here that another big takeaway was that while Nova Scotia, that majority is tending to do well, we on average are about at equivalent to national level estimates through these surveys, or maybe even doing a little bit worse in a number of areas. There were few where Nova Scotia is kind of setting the bar nationally. Concerningly, you'll see this data that reflects some poor life satisfaction for about 1 in 5 respondents to the health, behavior, and school-age children survey, which again feels like an unacceptable number for Nova Scotia. We know that some kids are not prepared with the skills they need for school as measured by the Early Developmental Index. That was about 1 in 4 for children in Nova Scotia, about on par with national estimates. Thinking about kids' access to green space, for example, which we know that really shapes well-being. Again, majority having access, but an unacceptable number without access close to their home, as measured by a Statistics Canada survey. I'm not going to run through every single point here, but things that we know clearly shape well-being, for example, nutritious food, kind of surprising to see on some level how few kids are eating fruits and vegetables daily. But I think it brings us to this idea of social determinants of health, and to really understand any one of those critical data points, we need to really have a discussion about what are the factors that shape them. And Sandra's going to reflect on some critical data about injury, which, as we know, is an important health outcome. And we know injury itself is the product of key social and environmental determinants of health. And so many of the outcomes I've just mentioned are also so critically influenced. And I recently read this description from 2 authors, Bircher and Kurovila, I think is how you pronounce it. I believe it kind of nicely captures the influence of health and of the social determinants on health and well-being outcomes. I'm just going to read it to you. So basically it says that the concept of social determinants takes into account the way that unequal distributions of power, income, goods, and services, the consequences of unfairness in the immediate visible circumstances of people's lives, their access to healthcare, schools, and education, their conditions of work and leisure, their homes, communities, towns, or cities, and their chances of leading a flourishing life. So I felt like that kind of captures really the determinants of health, many of which many folks here will know of these things already, which are income, housing, racism, sexism, discrimination, all have such a critical impact on influencing some of these key health and well-being outcomes. And I just wanted to take a second to show you from our report how we found income as a social determinant to influence some of those child well-being outcomes that I had mentioned. We know from a huge body of literature that the monetary resources a child's family has access to, how much money they have relative to others, is super critical in determining a whole range of their outcomes. We know that it influences their physical health challenges, to their learning and educational outcomes. And of course, there's not like a specific dollar amount above or below which kids are suddenly happy or healthy. So it's really important to think about how those monetary resources influence feelings and behaviors and ultimately outcomes of children and youth. And I think that's really best understood by by thinking about how income or lack of money creates deprivations for children and youth. So the deprivations created by income or lack of monetary resources can be material in nature, like families not having enough money for food or a car seat or even like a small birthday gift on a child's birthday. They can also be relational. So if a parent has to work multiple jobs to make ends meet, it might impact the time they have to spend with their children. And deprivations created by lack of money can also come about through opportunities. So how much money a child's family has might limit their ability to participate in extracurriculars or continuing education. So we know that all of these pieces really impact well-being outcomes. And I would say we very much saw that play out in our report. So you can see how those deprivations might come through the data. And I'm just going to show you on this slide the impact of income, how that was captured through the Health, Behaviors, and School-Age Children survey, who used questions about a family's affluence to look at how different outcomes might be impacted. So in 2019, this survey was completed by about 2,500 students in grades 6 to 10 in Nova Scotia from 21 schools across the province. And the results really show that for children and youth living in families with the lowest affluence, they were more likely to feel low, depressed, or lonely, more likely to be less satisfied with their life overall, less likely to eat fruits and vegetables, to be involved in organized sports, etc. So not only do we know it from the literature, and not only can we be concerned in terms of broad outcomes for population in Nova Scotia, but we can really see how a child in Nova Scotia's specific access to quality social determinants of health impacts their outcomes. And so I think as we're talking about improving health and well-being, like prevention or treatment of injury, we just have to consider the influence of these determinants, whether it be income or education or transportation or racism, sexism, discrimination. How do we build solutions that appropriately take into account those determinants of health? And I think you'll see that there's a cost of not adequately addressing these structural and social determinants, and I think that will become clear through Sandra's discussion. I'll just quickly show you some of the recommendations. We did focus our recommendations from our report on tackling what will be two of these key determinants or threats to child rights and well-being, which we believe to be systemic racism and discrimination and poverty as kind of most influential at this time. The four other recommendations just center around how we would lay a strong foundation that would help keep kids on the agenda through good data collection and kind of prioritizing their well-being. And we're pretty pleased that a lot of these recommendations are aligning with current work. But if you would like to read more about them and become involved at all in the One Chance to Be a Child work as we push forward on these recommendations, you can visit that website I mentioned. That's just a quick overview. And again, I just wanted to acknowledge the people that were a part of this project who were numerous and very passionate, as I mentioned. So happy to take any questions quickly if you have them. Thank you.
Yes, this report is so important. I wish we had time to do a whole session on the One Chance to Be a Child report on its own. So maybe in the future we should do that. Laura, do you want to stop sharing your slides? And maybe when I'm trying to bring my slides up, if anyone has any questions. Oh, is someone?
Yeah, sorry. It's me, Sandra. It's Arlene. Quick question for Dr. Simas. Based on the fact that data was started in 2018, I know that there's a time lag. Sorry, I know that there's a time lag. Do you think that would in any way affect the validity of the report or the veracity of the report?
Not sure if I caught the initial part of your question, but I believe you're just asking whether the time lag in terms of getting data together would impact the ability to use this information. Okay. Yeah, certainly it took a long time to get this together, but I think I guess my assertion would be that it doesn't impact the validity, mainly because just the nature of data collection is there's always going to be an innate time lag between collecting data and having it available to the public to be able to use. So I think if we got into that habit of suggesting that the lag takes away validity, we would never be up to date or never be able to use data. I think if you go through, you'll find that most of the information included use the most up-to-date version of the data that was available. So we intend to continue following these points over time. So I also think the validity and ability to speak to trends will increase as we continue to put this together over the years. So yeah, I think that's just the nature of data as it is. And also, I think it will grow in terms of meaning in time as we continue to create further iterations of the report. I hope that answers your question.
It does, and from what I'm seeing, because I took the opportunity to go just to do a brief glance at the report, it looks like it's going to be a great launching point, starting point for the continuation of the studies and to further develop the data. So congratulations, good stuff.
Thank you.
Well, thank you, Laura. I think I'm going to go into my presentation, but there will be opportunity for questions at the end of mine as well for both presenters. And I just want to also thank you for presenting on this report, because every time I think about the social determinants, it always is so thought-provoking, and it's such an important piece of work for all of us to consider. And Laura will be sharing with me her slides that we will make available to everyone as well. So I'm going to switch gears a little bit and present another recent report entitled The Cost of Injury in Atlantic Canada Report. And it will take me just, well, no, I got my slides up. Everyone can see my slides?
Yes.
I'm going to assume that's a yes.
Yes,
Great.
That's a yes.
Sorry, I can't see people. Great. So I did set up a few learning objectives for my presentation, and they are as follows. By the end of this presentation, you should be able to list the top 3 causes of unintentional injury hospitalization in children 0 to 14 years in Atlantic Canada. You should be able to name the cause of the highest cost of unintentional injuries in children 0 to 14 in Atlantic Canada, and know the economic cost of unintentional injuries in children aged 0 to 14 in Atlantic Canada. Unfortunately, our original plan was to actually have a pre and post test to capture your knowledge prior to this presentation. Unfortunately, the technology failed us, and so I will go over these at the end nonetheless. So you may know that last year, Parachute, the National Injury Prevention Organization, released a national cost of injury report. And this cost of injury report was done in collaboration with the BC Injury Research and Prevention Unit, with support from the Public Health Agency of Canada. And this report is available on the Parachute website. The report quantifies the cost of injury from a societal perspective, including cost to healthcare systems, to productivity, and to the people behind the numbers, individuals, families, and communities. You will see a theme. You will see that the cost of falls and motor vehicle transport in children is staggering. Unfortunately, with this national report, they were unable to break the cost down by province. And so the Atlantic Collaborative on Injury Prevention, or ACIP, coordinated an Atlantic cost of injury report with provincial breakdowns with funding provided by the 4 provincial governments in Atlantic Canada and Child Safety Link. Using similar but updated methods from the national report, the 2022 Atlantic Canada report presents data on all injuries at the regional level from the year 2018. The report is published online only using an interactive data visualizations. The report examines data on injury across Atlantic Canada from 2018, the latest year for which complete statistics are available. It unmasks the economic costs of unintentional and inflicted injuries and the biggest causes of injury in Atlantic Canada. This includes the cost, just like the national report, from societal perspective, including the cost to the healthcare system, productivity, etc. When you go to the link below, you will have the opportunity to look at the data, and you can filter it you can look at all the different ages. So obviously I'm focusing on children 0 to 14, but you can go into this report and you can filter in different ways. So you can filter by province, you can do it by specific age, etc. And you can do, yes, and by different province. So throughout this presentation, I have pulled information specific to unintentional injuries to children and youth 0 to 14. ASIP also created this infographic that highlights the high level information overall. This is all ages, intentional and unintentional injuries. ASIP is currently working on a child and youth specific infographic that is still in the works, but will be completed very soon. Once it's completed, it will be translated into French and it will be put on our website. Child Safety Link is also creating provincial specific infographics that highlight the key data by province for unintentional child and youth injuries only. These will also be on our website and we hope to do that next week. So for children up to 14 years old, when we focus specifically on unintentional injuries only, such as those caused by motor vehicle crashes, falls, burns, drowning, and poisonings in Atlantic Canada in 2018, there were 8 deaths, 750 children were hospitalized, there were 46,181 emergency department visits, 184 children were disabled, and this all cost our society $117.3 million, and this is for 1 year only. The number one cause of death is for 2018, it was fires and burns with 5 deaths. However, I am going to caution that when interpreting this number, because every year is different, and just taking 1 year into account can misinterpret findings. So usually we tend to look at an average of the last 3 or 4 years to get a true sense of the leading causes, especially when the numbers are small, which is obviously we want them to be small. The number one cause of death in Canada is transport injuries. So for specific provinces, you can see here that I outline the total cost for children 0 to 14, unintentional injuries, and the rates. So if you look for Atlantic Canada, the cost is $117.3 million, and the rate of hospitalization is 218.6 hospitalizations per 100,000. We do know that hospitalization rates have decreased from 2004 to 2013, but the hospitalization rates for unintentional injuries in Atlantic Canada are still higher than the national rates, as you can see here. You can also see all the provincial rates, so you can make comparisons if you wish. PEI does unfortunately have the highest overall hospitalization rate, and unfortunately it is also significantly higher than the Canadian rate. In terms of specific causes, you can see that falls in children are by far the greatest cost to Atlantic Canadians. Falls alone cost $52 million, and this is just children 0 to 14 in Atlantic Canada. We saw 354 children hospitalized and 19,366 emergency department visits. Second, we can see transport at 11.88 million, 108 hospitalizations, and 2,628 emergency department visits. And when we talk about motor vehicle, that's motorcycles, car, buses, trucks, ATVs, etc. So you can see even between falls, the number 1, and transport number 2, there's still quite a difference in the numbers. Fire and burns was also the third cost of cause in Atlantic Canada with 5 deaths and 31 hospitalizations. And then unintentional poisonings was 4th with $2.12 million, 51 hospitalizations, and 816 emergency department visits. I think we'll pause on that slide for just a second. So, but I think it's pretty significant, the numbers. Now, I've included a few slides for your reference so you can see some of the charts from the report. So I'm not going to go through this slide, but as you can see, the significant number of emergency department visits for unintentional injuries. I don't know if you can see I don't have a cursor, but I've made a note here for unintentional just so you can see the numbers in the chart. It also includes intentional, inflicted, and undetermined. And this is what the charts look like when you do the searching. As you see up top, you can do by the region, you can select the measure, the age, and you can do it by the different sexes as well. This is another slide that I thought, another chart I would include for your reference. So this slide includes outlines all of the causes, both intentional and unintentional. And again, I just put this in here for your reference, and these slides will be available, so you don't have to take any notes. You can see that other unintentional injuries is very high. However, we were told other unintentional injuries should not be seen as the leading cause of injury. These are the lesser causes that are all grouped together, and this includes lots of different things like being like a tree falling on you, bitten by a dog, choking, exposure to an electrical current, being struck by lightning, and so on. So there's a long list. All of the definitions for this report is available in that in the link I showed you. You go in there and you'll find appendices, and in the appendices it'll list all the data sources, and it will also list all the definitions, so you can get a really good sense of what means what. Again, just for your reference, I've outlined 2 slides just of the number 1 and 2 causes of injury hospitalization. So we have children again, falls is by far the highest rate. Atlantic Canada does have a higher hospitalization rate than the rest of Canada when it comes to falls. And you can see the cost of falls in Atlantic Canada is $151.64 per person. PEI also has the highest hospitalization rate and the emergency department rate in Atlantic Canada. And yes, in Atlantic Canada. When we look at transport, we actually have a little bit of good news that Atlantic Canada has a lower death rate than in Canada. You can see the number there. PEI again has the highest hospitalization rate. They have 4.1.5 versus Canada, which is 25, so that's significant. Atlantic Canada also has a higher emergency department rate than the rest of Canada. And I think we would like to believe that that's because we have very strong car seat laws here in Atlantic Canada, and we do a lot of work in that field. So I know I went through that incredibly fast, but I wanted to give you just a very brief overview of the report. So I'm going to make you work a little bit. I know that I couldn't do a pre-post, but I've got the original learning objectives here on the screen, and I would like you to answer these questions in the chat if you could, and I will check them afterwards. So I wanted to reflect on these 3 learning objectives. So what are the top 3 causes of unintentional injury hospitalization in children 0 to 14 years in Atlantic Canada? I will give you a moment. Okay, the next one is to name the cause of the highest cost of unintentional injuries in children 0 to 14 in Atlantic Canada. Just put that in the chat. And the last one is to know the economic cost of unintentional injuries in children aged 0 to 14 years in Atlantic Canada. Before I get to the answers, I just want to say I really want to encourage you to go to the report and go through the different tables and sort of play with the filters, and you can really narrow down quite well. And I think it's important for everyone to go in there and just take a look. Well, thank you for those who participated in the chat. I'm going to put the answers here now. The top 3 causes are falls, transport, and unintentional poisonings. For the highest cost, it's falls at 52 million. And the economic cost for unintentional is 117.3 million for unintentional, and for all injuries, it's 123 million. To conclude, I wanted to bring to your attention another report from Child Safety Link. A few years ago, Child Safety Link wrote a report that outlines best practice work recommendations that support the key ways children are injured. It's divided by topic. So for example, child passenger safety, poisoning prevention, etc., and by best practice. And we've done that by the ease of injury prevention. That would be education, engineering, and enforcement. We also break it down by federal, provincial, local, and organizational role where we could. This guide is available in both English and French and is on our website. And we also have some printed copies that you could order free of charge if you're in Atlantic Canada, so you can just contact me if you would like this report. I encourage you to review this document and think about how you can support injury prevention. I want to thank you very much for your interest. And now we can take some questions for both of the presenters. Any questions?
There's a little uncertainty in the chat just regarding the top 3, I think. So can we just confirm what those top 3 were, Sandra?
Top 3.
Falls,
Huh.
transport.
Oh, I may have made a mistake. Let's go back.
It's supposed to be false.
Falls, transport, fire
Oh,
burns, and
right.
unintentional poisonings. I was wrong. I was too quick. Thank you for someone pointing that out.
I think there's Andrew Link wants to talk.
Hi, Sandra. Thank you. That was very helpful. I just wonder, do you have data in the report that sort of breaks down the falls into subgroups that are sort of maybe amenable to prevention or intervention? I'm just curious.
Yeah, I thought about putting a slide up on that, so I don't have it in front of me, but yes, you can break it down and you can look at it by age. So we can sort the falls by the different age groups, like 0 to 4, 5 to 9. I always get the age groups mixed up, but there's a series of age groups. And then you can also search by just 0 to 14 on its own. So you can go in and they break it down by like stairs, playground, falls from a certain height, etc. So yes, you can do that. And we're going to be doing a fall specific infographic for Child Safety Link as well. That's just sort of on our to-do list, and we'll be putting that out for November is National Fall Prevention Month, and so we'll be releasing it then.
And a quick follow-up, Sandra, just in terms of the fires and burns, just curious if you could comment whether there's trends on scalding injuries, whether that's getting better, worse, or kind of staying the same.
Yeah, I don't have that information. Yeah, the fire and burns data, as far as I can remember, is just fires and burns. They don't break it down. And I don't have any other information. However, we do have a report that Child Safety Link put out a couple of years ago looking at hospitalizations in Atlantic Canada and by province, and we do pull out burns there. So we'd have to look at that to see if there's been any changes.
Okay, thank you.
Yeah. Any other questions?
Sandra, there's a question in the chat just wondering about sports injuries and if it shows up anywhere.
Yeah, sports injuries are there. Where are they on the list? I think I have them in front of me here. So we look at struck by and against sports equipment is lower down on the list in terms of the cost. So falls is number 1, transport 2, suicide, self-harm is 3, violence is 4, fire and burns is 5, drowning is 6, undetermined 7, struck by and against sports equipment is 8. So I'm not sure about the sports injuries if they break it down any further in the cost of injury report, but because it wasn't in the top 5, we didn't focus on that one. But you could go into the report and search it.
I have a question for Laura with regards to her report. One of the pieces at the end, I think it was number 2 listed, was with regards to child poverty. And I think it was reduce or eliminate, such a big word. I love that eliminate child poverty is in there. Living in the Cape Breton area, we have 1 in 3 children living in poverty. That number has not moved. I guess on the positive side, in the last 2 or 3 years, it hasn't gotten worse. I suspect if we were to do it again after the current economic situation that we're in, it might look worse. I'm just wondering, with all of these points, but in particular the poverty one, do you have pieces already in place as to how the action items as to how to deal with that or moving forward? It's a huge undertaking for sure. And you may not have the answer. I'm just curious with all of those points. I think there were 5 maybe key points that you were speaking of, and I'm just wondering, do you have action items underneath or places that you want to move forward or directions to go to start to address those?
Right. No, that's a great question. I think like it's in the interest of many groups and individuals across the province to kind of figure out what are the levers to move towards solutions. You can find on the website, so we did expand our thinking a little bit on pretty broad strokes on actions that could be taken to move the mark. One was establishing like a proper plan to respond with clear explanations of what types of policy levers would be used and really something that is data driven, and then medium and longer term targets that are achievable. And then we had also asked for the action of legislation to be passed around a commitment to ongoing work to reduce and eventually eliminate poverty. So those were the two main actions we had called for: a strong plan with targets and clear outline of policies that will move the mark, and then legislation that commits all future governments to poverty reduction. So we're kind of working ongoing to move those pieces, but I'll just mention too that we were lucky as a part of this work to be invited to take part in a government process looking at costed approaches to poverty reduction. So I guess what I can say is there's work underway to look at specific things, whether that's changes to the Nova Scotia Child Benefit, across the gamut of potential solutions. And I believe government is looking at options right now. So our report kept the actions high level, but to your point, it's a huge issue, and I think there's a number of different directions, different policy positions or different programs or services that can move the mark. So we're hoping to set a tone that this issue is important and needs to be moved on, but I think that requires a bunch of work at a bunch of different levels that is more specific and probably we don't have time to get into today. But if you're interested in seeing those two high-level actions described in more detail, if you go to the website under recommendations, you can download a one-pager that talks a bit more about those points. I hope that answers your question.
No, that's great. Thank you.
I have a few conclusion slides. Mallory, are there any other questions?
Not at this time.
Well, thank you, everyone. That hour went by very fast. So thank you so much for attending this inaugural presentation. We will, as I've said a few times, be putting these presentations and hopefully the recording on our website in the coming weeks. I would also like to invite you to attend some future webinars. So our next webinar is on September 21st, and that's during Child Passenger Safety Week. And the topic is Child Passenger Safety, Buckle Up Toolkits and Resources. And Catherine Hutka from Child Safety Link will be doing that presentation. We're also in the process of developing a community of practice, and this is going to be an opportunity to provide space for open communication and discussion around child and youth injury prevention. And that's in the works right now. And we do hope to be able to launch this around our birthday in November. If you are interested in being a member of the community of practice, keep an eye open for announcements, but you can also email me and I can put you on a list. And I do have my email on the next slide. So you can see our Child Safety Link email, but I've also put my email at the end. I've also put a link to all of the Child Safety Link services that you can get access to on our website by province. So again, I want to thank you so much, but before we end, I just want to make sure there was no other questions. Thank you so much, everyone. I don't think there was too many glitches. I think we got through relatively smoothly. So I want to thank you so much for attending, and I hope to see you at their next presentation. Thanks, everyone.
Thanks, Sandra. It was well done.
Thanks, Suzanne. I think a few of us are just going to hold on here.